Did you know 60% of health workers feel burnt out? Are you one of them? I take active steps to make sure I don't feel burnt out, and in this video I'll share them with you so you can prevent yourself from feeling burnt out as well. The World Health Organization defines burnout as stress that has two elements. The first element is stress that feels uncontrolled or unmanageable, and the second is stress that is prolonged. So let's start by examining what causes stress. There are two factors that cause stress: internal factors and external factors. I chose to be a rehab clinician because I want to help my patients. So this is one of my internal factors, really wanting to help my patients. I want to give them the best treatment, so choosing the best treatment for this patient to start off with is a challenge. I'm unsure about their potential for recovery. That's an added stress for me, as is the question of whether my patient is getting enough rehab, or perhaps am I expecting too much from them. The external stresses are around pressures in the health system to discharge my patient earlier, to select discharge destination early before perhaps I feel that I'm ready to say that because I don't know my patient well enough yet. And also questions that the family is asking around prognosis and the competing demands on my patient's timetable, namely the various therapies, medical appointments, investigations, tests, and so on. In the current system, when I have those stresses on me and I feel like there is nothing I can do about it because the health system is changing, I don't have enough time to see my patient to get the information that I need, and then I feel that I can't treat my patients adequately or give them what I think they need. This feeling is prolonged because the health system is not changing and the pressures are just increasing. So I'm at a high risk of burnout simply because I care so much about my patients. Looking at brain images help me control the internal factors and external factors that affect my stress. When I look at the brain images, I understand exactly what the problems of my patients are and why they have those problems. Therefore, I know how to help my patients. I know what treatment I should be choosing first, and I'm clear about their potential for recovery. Then I know exactly how much rehab they need, and I set realistic expectations and goals for my patients. I also use the brain imaging data to advocate for rehab when I think my patients need more rehab time. Brain images also give me clarity about where is the best place for my patient to be discharged to, and it helps me answer questions of the family about what's going to happen in the future. No, I don't have a crystal ball. I can't tell them exactly what's going to happen, but I can tell them what the potential for recovery is. Brain images also give me data for prioritizing the therapy time of my patient. By looking at the brain images, I know I'm giving my patients the best treatment I can. It gives me the feeling of control, that I'm using the time I have with my patients the best way possible. And if I can't do certain things with them, at least I know how to direct the family to do so. By eliminating the uncontrolled or unmanageable component of stress, I'm reducing my risk of burnout. So gain brain imaging education so you too can reduce your stress level and feel like you're giving your patients the best treatment possible. Brain imaging helps you understand your patients early, identify recovery potential, and tailor the treatment to the problems they have. So head to my website and enroll to one of the upcoming brain imaging courses and protect yourself against burnout.